relate. Norm, I think, did a good job explaining some of those horror cases. But if you've got a minute, I would love to maybe speak truth to power. Maybe just a little overview on how we got here in the first place. At the end of World War II, the United States, and by the way, everything that I'm getting ready to say is going to be documented somewhere in this truth. This is not the myths that's being set forth by the Republican Party. At the end of World War II in 1945, the United States was number one in the world for life expectancy. Number one in the world in infant mortality rates. I'm sorry to say, since that time, we have slid to number 27 in life expectancy and number, 30 now, 30-something, in infant mortality rate. People, this is unacceptable. Our quality of care, as measured by in part life expectancy and infant mortality, has now ranked us number 37 in the world in quality of health care. I think this is an unacceptable place for the richest nation in the world to be in. A study I came across just, in fact, this morning was, and I'm going to have to look at this because there are 6 countries that are involved. The United States spends 2 times as much money on health care as Australia, Canada, Germany, New Zealand, and the United Kingdom. Yet, out of these 6 countries, we rate last in accessibility, patient safety, efficiency, and equity. And I just think that's a real shame on us. Now, how did we get here? How did we get here? I think the private insurance companies have a lot to answer for. I don't think they've done their job. Our premiums have gone up 120% in the last, 10 years. We have 47 million Americans who are uninsured, can't get health insurance because they can't afford it. We spend way more than we should. Who's getting the money? Follow the money. Use your common sense and follow the money. The big 7 health insurance companies, in the past 7 years, their profits have increased by 400%. So who do you think is behind the effort to squash health care reform? Is it the people like you and me? No. It's the big insurance companies, the big corporations that are funding a lot of misinformation to people, and unfortunately, people are not checking to see that this is just not true. And I just think our country can do a heck of a lot better. And anybody that takes 30 minutes and goes on the internet and just can Google healthcare in the United States, and you can read all these articles, and it becomes amazingly clear that what we're doing is not working. There's also statistics that say if we keep going like we're going now, in 10 years, small businesses won't be able to make a profit because the health insurance cost is going to eat up all their profits. So we can't continue on this course. And I would just urge everybody to use their common sense. When people come to you and say, oh, this health insurance bill is going to kill seniors, kill old people, does that just sound unreasonable? You know why it sounds that way? Hello, it is. That all goes back to one amendment that was submitted in the House bill by a Republican congressman from Georgia. I saw him interviewed the other night, and he said, look, all this is people being asked, he said, I want to cover with insurance the consultation provided by the doctor for end-of-life decisions. Now, as a hospital worker, we've been asking people for 10 or 12 years now. Every time somebody's admitted to the hospital, we ask them, do you have a living will? That's what end-of-life decisions is. It's a living will set forth by the patient to describe what they want to happen should they get unable to make medical decisions. And we've been asking that question forever. What this amendment does is say we ask that question and the patient says, yes, I'd like to talk to somebody about a living will. Well, now, if it's going to be a covered service, as proposed by this amendment, the doctor or his nurse practitioner or someone with some authority can actually go in that patient's room and talk to them about what they can expect and make those end-of-life decisions before they become medically unable to. That's all this amendment was. And it has been taken and twisted and tweaked, and now there are actually people that are saying this health care bill is going to kill seniors. You're going to kill old people. So I just urge you, pay attention to the debate. Pay attention to what's being said. There's also a website, and I don't have it with me, it's out there on the table, but you can go to this healthcare website and there's a lot of myth busters that's explained. So, are there horror stories out there? Yes, there are plenty of horror stories. The lady who had cancer and lost her job because she was unable to work, and then when she lost her job, she lost her health care. Then because she'd had the cancer, she couldn't get coverage. That was now pre-existing illness. Even if she was fortunate enough to find another job, she couldn't get coverage. She ended up dying because she couldn't get coverage. I mean, I don't know how aware people are that there are tens of thousands of people in the United States that die every year from treatable illness. And why they don't seek health care is because they're locked out of the system. Can't. Okay? I also heard a statistic the other day that two-thirds of cancer patients have to forego either some type of treatment or some type of medication because they can't afford it. Now, people, this is the United States of America. Come on. We have got to stand together. And we've got to do this. The Democrats have been trying to get health care reform for what, 40 years, 60 years?
60 years.
60 years. I think back, I know most of you in here don't remember the big Medicare kerfluffle that happened. You do? Remember Lyndon Johnson wanted to pass Medicare, and oh my gosh, the Republicans said this is Armageddon, this is going to be the end of the world, this is going to bankrupt the United States, it will never happen, blah, blah, blah. It was passed in the Senate by what, John? 51 to 49. That's how close we came to not getting Medicare. Which, by the way, is a single-payer, government-run health care program. Sign me up. I'm 62. I can't wait. Anyway, this is just kind of off the cuff, but thank you for listening to me, and stand strong.
Thank you. Healthcare now.
So that's all we got, folks. Enjoy the food. Thank you so much again for coming out. Just want to remind you about hoping you guys can join us on Wednesday at noon in front of Senator Lincoln's office. And also, before you go, please do write those healthcare letters in the other room we have. Because the more healthcare letters we get today, and the more people that sign the declaration we have, the more we'll be able to give to Senator Lincoln's office on Wednesday, and they'll make that much more of a difference.
Where's Senator Lincoln's office?
Oh, thank you for asking. It's right downtown near the Federal Building, right next to the courthouse. Somebody help me with the
Main
intersection.
Street in Washington.
Main Street in Washington. Thank you. Yeah, it's right out. It's right in between
South
courthouse and the Federal Building. Yep. All right. So thank you and enjoy the food.